All right, everybody, welcome back to the Real Talk with a Foot Doc. I am Dr. Tim Miller. To my left, as always, Dr. David Schweibish. To my right, Dr. Edgar Sy. Edgar Sy of Relief. I love that.
Relief. Yeah.
I love that.
That's my hashtag.
It is your hashtag?
Yeah.
Well, now it is.
I think so.
It better be.
I say the same jokes to my patients, and I have students in residence.
Do you?
And they're always like rolling their eyes, but the patients laugh.
Oh, I would never roll my eyes at you.
Oh, that's good.
Ever.
Yeah.
Ever.
Guys, can we get to work?
Okay, so we're going to get to work. We're going to do a follow-up on our feet on the street, on our running around, talking with different people about podiatry and what we do, and kind of get a general knowledge on some things that people may not know. And our audience, this is for you guys, our audience, our listeners, our viewers. We want you guys to be well aware and well informed about podiatry and how podiatrists can help you. So we had some fun times running around the Grand Hyatt Resort in Bonita Springs.
That's to say the least. I think I learned a lot more about mankind doing that. That was very interesting.
It was.
Yeah.
It was interesting. What did you think?
I thought it was funny. It's funny seeing the medical students too, kind of getting asked and seeing how they would like.
Because you thought
stuff.
they were, so anybody who doesn't know, Dr. Sy, he is a professor and residency director. So I thought they probably thought they were getting pimped at least, right?
Probably.
Yeah.
To be fair, I haven't had them yet, but yeah, I thought, so I thought overall, it was a good, I know we're going to roll some clips and everything, but I thought it was good. I like seeing that.
And they looked at me and they're like, who's this joker? And I'm like, I don't know who I am. So, I mean, Dr. Schweibish is president, so they know who you are.
They know who I am.
So I'm just the lowly secretary right now. So
we'll get there.
We'll get there, buddy. All right. So
but let's talk a little bit, because we had some very interesting conversations with people that have got to be discussed.
do you know how many bones are in the foot?
Bones. 206. No, I'm kidding.
That's a lot of bones for the foot there. So in the foot.
30.
75.
75.
100.
Okay. A little high.
Yeah?
A little high.
35.
Oh, now you're getting close.
28.
28. Wow. Okay.
28.
Ooh, okay. All right. Is that the right answer? We'll find out.
Oh gosh, is it 26?
26.
I'm gonna go 26.
26 is correct.
Is that the right answer?
Yes, I think so.
We'll find out.
I would say 24.
24. Okay.
In the foot?
Yeah.
Well, there's 200 and something in the body.
Okay.
Probably about 50 of them in the foot.
Okay. Okay, cool.
It's like 48.
Okay, 48 and 50 something. Okay, so somewhere around there. So, Dr. Sy, how many bones are in the human foot?
28.
There are 28
28.
bones in the foot, and we had as many as 75.
I think we even had one over 100.
Did we have one over
I think
100?
We had one answer over 100.
Maybe I know somebody said there are 206 bones in the body, but so then there's got to be 50 in the foot. So I don't know where that math adds up, but it was funny to hear the different answers, and just what I always find interesting is that we should know at least some things about our body generally, and I think just people not knowing or not sure about bones in the foot, I think just values our profession more, right? There's 228 bones, ligaments, tendons, all that, and just having such an intricate part of our body, and we dedicate our professions and our lives to podiatry and to podiatric medicine, it just gives us a unique perspective on that. What do you think?
No, I think I agree. So technically too, there's 26, and then our big toe has 2 little kneecaps. Funny enough, that makes it 28. So it's kind of like a trick question, but little kneecaps I call them. But proper word is sesamoid. But I think it's kind of interesting because the foot is like a tire of a car, and if there's 28 bones in your foot, and there has to be kind of like a bridge. Right? There has to be an anchor to kind of hold the bridge. And if you have 4 ligaments, dorsal, plantar, medial, lateral, or just ligaments to kind of hold it, think about all the soft tissue that we have to do, right? Think about all the muscles and tendons. And I do think that's why there's so much importance in our field, because, we have to respect the soft tissue. When somebody sprains their ankle, like Lionel Messi during the Copa final sprained his ankle, there was no fracture, but he was still out 6 to 8 weeks, right? And it's like, well, he had no fracture. But that's kind of like where we come in, right? And those are, we're getting up a little bit higher, but these are part of stuff that we treat. And if I'm not mistaken, you asked somebody like, hey, you have shin problems? We could treat that. And they right away went ortho. But it's like in actuality, we could treat that as well.
Absolutely.
Yeah, below the knee, come see me.
Yeah,
You've said
that's
it a
it.
million times.
I love
the past several years. And,
Hashtag.
makes a lot of sense. But I think for at least for the audience listening, you're going to have people who are thinking, there's really that many bones. Obviously, going to do a Google search. Check it out. Look at the imagery just to believe it, because it's a weirdly complex part of the human body. And so many people come into my office and they're asking, like, this thing over here, this bone or whatever it is hurts. And then we talk about all the complexity around that one single site, all the other bones. And then you kind of realize, wow, it's really not just this one thing that could be broken. Like you said, it could be a ligament or some other structure. So
Exactly.
I think it's just creating some awareness about the fact that this is not just some weirdly simple part of the body. There's a reason why you need the specialty of podiatry. We need people to actually comprehend the complexity of that part of our complex structure.
We need feet. We need feet, right? And we all need feet. We want to do things. We want to run around. We want to have fun. We want to enjoy the resort. We want to play with our kids. We need our feet to do that.
Amen. All right.
And
So,
Hit the next question.
Dr. Schweibish,
Yeah.
is walking barefoot good for you?
Jeez.
Do you think it's good to walk barefoot?
No.
Been seeing a lot more of this out there. Like it should be less frowned upon than it is, but generally no.
Do you think walking barefoot's good for you?
No, I think
Okay.
it's the worst thing in the world.
Gotcha.
And the kids run here and I hear their bones tapping on the cement. It just kills me.
Gotcha.
And I just want to say, hey, parents, don't let your children do
Okay.
that.
Okay, good. We see a lot of people running around the pool here barefoot. Do you guys think that's good? No?
No.
Okay.
I never do.
Okay, good. You never do. Good. That's like a podiatrist's dream, is hearing somebody that never walks barefoot, right? So,
I mean, only in my house because we don't like to wear shoes in our house. but-
gotcha.
And we'll be right back after a word from our sponsor.
At Barry University, we started using ModMed. It's a very easy touch EMR system for our providers and our students to get better accuracy, much more office flow efficiency. You have the availability for a desktop and an iPad.
So I think that was probably one of my favorite questions that we asked, because you get a lot of variety. You really do. You get so many people who think, oh, just let the foot breathe, let it relax, let everything stretch out. It's good for you. There's obviously a lot out there about a minimalist shoe gear or minimalist activity with regard to your feet. I think there's even some pretty good literature that's trying to come through a lot of the exercise physiology world about the improvements that you can gain with barefoot activity as it pertains to stretching and things like that. However, generally speaking, in my book, barefoot walking does you no good. And I have found that it actually leads to more problems than any other kind of good that we can achieve out of it. Obviously, children are usually in a different category. They're a little bit more versatile. They've got more of a fat pad on the bottom of the foot. They've got more resilience. But generally speaking, I do not advise that people go barefoot.
Do you guys get in your office? I get this a lot, and this is a very like a myth buster, or when you get runners and they go, well, I heard this running, like barefoot running is better, right? So not only is barefoot walking good, but now there's been a trend, whether it's companies kind of pushing it and just social media, whatever it is. How do you guys tell your patients? Like, what do you guys say to your patients? Hey, is barefoot running good? I'm trying to get back in shape. It's summertime in Florida.
That's a great question, because I get asked that a lot. And one of their arguments, especially these athletes, is that, well, if I'm using something to support a part of my body, then I'm weakening that part of the body, right? They think that since you're not using the muscles, the ligaments, the tendons in your foot, that they're getting weaker. And I always tell patients that, as 300, 400 years ago, when humans were walking, more often than not, they were walking on soft grass, sand, something that had at least some give, where a lot of the forces, when they put their foot on the ground, were dispersed, were pushed out through the ground. And then I turn around and I ask them and I say, when is the last time you walked on something soft? And they say they can't remember, because they walk on concrete. They walk on hardwood floors. They walk on linoleum, right? And I say, every time you step down, those forces, when you're on a harder surface, pushing back into the foot, causing more stress and strain on their ligaments and their tendons.
Love it, but I can do it a little simpler. Can I tell you my answer to those people?
Please simplify.
And this is actually something I borrowed from my wife, also a podiatrist. And she brought it, I think, to my attention very early on in our careers, and I've since adopted it. If you come into my office and you're a runner and you talk about barefoot running, I always ask the question, why are you in my office? If you're in my office because you have a problem, you actually have pain or strain or some kind of an issue that's developed perhaps as a product of your running activity, and you've been barefoot running, it's probably not for you. But if you're the type of person who's actually been able to do barefoot running and you've done so successfully for years and not had a problem with it, go for it. Simple as that. It's the same thing with people going barefooted. Some people can tolerate it. Some people do well with it, but some don't. And if you're in my office and you actually have an issue that you're seeking counsel on, and you've developed an ache or a pain, or you're getting a recurrence of pains, it may not be for you. You may just not have the foot type for it.
Yeah, it's funny because it got popularized from an American author going to Kenya, and then companies started doing that barefoot. And I agree, if you're in here, you cannot proceed with your barefoot running because you're already in pain. You're going to exacerbate your symptoms. So typically, I reduce the pain. From there, if there's more, depending on the patient, obesity, weekend warriors, they're a little less amenable, less likely they're going to be able to tolerate it. And I'm very honest with them. If you have like that college athlete or something along those lines and they're really going with it, sometimes I will try to work with them. Like, hey, if you haven't given it a shot or if you want to give it a shot, cool. But there is a particular type of running protocol to do where you gradually increase your activity, waiting 48 hours, because it does take about 48 hours for your body, delayed onset muscle soreness, also known as DOMS. Exactly. I know you would know with your biceps here.
Thanks, buddy.
But so I do have a specific protocol and I educate them as much as possible. Now, if they try it doesn't work, then we don't burn any bridges as well. But it is a very common thing. But I agree. I never walk barefoot. I think the more support, the better. Get some good shoes at all times.
Just to hit, so for our audience there, Dr. Sy just talked about DOMS, delayed onset muscle soreness. Any our listeners our audience who don't know about that, it's just usually 48 hours after a workout there. That's when the lactic acid builds up to a point where your muscles feel sore. That's why if you do work out or go for a run the next day, you might not be as sore as the following day afterwards. So just for clarification purposes.
Yeah, I have lactate acid at all times. I'm always sore. Yeah.
Okay.
Just why he's lactose intolerant.
There we go. Right.
Oh, there you go.
So then, you kind of brought up the barefoot running and all that stuff. What do you think about, Dr. Sy, what do you think about sandals or flip flops? Do you think anything supportive wise or anything there?
Yeah. So it's funny. In the Filipino culture, we call them chanclas or chancletas.
Chancletas.
So whenever I tell patients when they're in pain, I always say the word intentional. I want you intentional with the type of sandals that you are wearing. Don't just go to Target or Target as they call it and just get any over-the-counter sandal. Grab them from the middle, see if they bend, right? There are companies out there that allow a little bit more stiffness to it. Has a little bit of an arch. It does take a little bit of time. Surprisingly, I was also one that I was like, oh, I don't know if I can tolerate this. But I always tell them, be intentional, be in sandals at your home because, I hate when people walk in shoes at my place, more cleaning and everything like that. But get sandals, be intentional, make sure they're stiff. They can be soft, but as long as they're stiff, and that's usually how I go about it.
Thanks.
Dr. Miller, note to self and note for you and me when we visit Dr. Sy's house, shoes off.
Shoes off, man. That's it.
Shoes, yeah, please.
No, it's fine. No.
But I'll make you
So, but that's a good point because I have young kids that will eat off the floor because I'm trying to teach them, but they don't listen. That's something as well because I have people that they don't want to wear shoes in their house. So then what about, Dr. Schweibish, if you get somebody who comes in and says, you recommended a certain type of sneaker for them, but they're like, I don't want to wear sneakers in my house. What do you tell them then? What are some tips and tricks?
Yeah, and that's my patient population to a T. I mean, I'm in a beachside community. A lot of people, shoes are hot, shoes are heavy. I moved to Florida because I want to walk barefoot or I want to wear flip flops all day. And I think it goes back to what Edgar had mentioned earlier about finding, that middle ground. It's kind of a little bit of a compromise. You've got to find that higher quality product, higher quality sandal that's actually going to provide you some support, shock absorption. Some brands do it a lot better than others. And obviously, I think a lot of patients, I'll encourage them, bring in some options that you've got. Let's talk a little bit about why one is superior to another. The barefoot walkers, they're a tough sell. I mean, I get these people, they just insist on doing it. And we go through the talk about, hey, listen, this is why you've got so much callus on your feet. This is why you've got this ache or pain that you see me for. Here's why you're developing, why you're getting warts all the time because you're walking barefooted. And when you start to point down that road of, here are the reasons for your problems. And it all kind of stems from barefoot walking on your terrazzo floors, your hard, tile floors or wood floors at home. They start to connect dots and they say, all right, I guess if I want to age gracefully and do away with my problems, maybe I should listen to this guy.
Age gracefully. That's
Yeah.
what, and
Terrazzo floors. That's how I know you're the president. Terrazzo. I don't know what terrazzo is. That French? What is
Oh,
that?
come on. You live in Miami, man. That's
Terrazzo
like
floors?
home base
What
for
is
terrazzo.
that? You mentioned like lithium. I don't know. You mentioned some sort of other floor. I need my interior design.
linoleum.
game.
Linoleum's like the cheapest
Like the
floor.
oil? I'm just kidding.
Literally, like any builder who wants to build a cheap floor, they put linoleum.
Okay. So I'm gonna go linoleum.
So you can see he says something that's fancier than I am. I grew up with linoleum.
It ain't fancy. I'll tell you that much.
And if we may, we didn't really ask this, but I get this asked a lot when it comes to barefoot running or barefoot walking and being intentional with stiff sandals, stiff shoes, things along those lines. If I get to Walmart or Runner's Depot and I grab those running ones that are gel, like in Dr. Scholl's, whether we keep that or not, but we get those over-the-counter ones. Are those just as good as the medical ones? And how important are those? I get that question all the time as well.
Oh, that sounds like a great topic for a future podcast there. So I think
Spoiler alert.
spoiler alert.
Episode 4.
So, okay, this was a great question that we were asking as well. How many miles on average does the average human being walk in their life?
2 million, 3 million?
2 million, 3 million. So miles.
I don't know, like 500? I don't know.
500 miles?
Yeah.
Okay. When a marathon is 26 miles.
Gotta be maybe short of 1 million. I don't know.
Short of 1 million.
Depends what country or continent you're looking at.
2,500 miles. I don't know.
2,500 miles.
Okay. All right. We're getting there. All right.
Millions.
Millions. Okay. Cool. And we'll be right back after a word from our sponsor.
Dr. Williams got into medicine because she loves helping people. So imagine how it feels when she can offer a same-day appointment to a new patient like Mike and have his medical history right there on her tablet, with the system capturing the exam findings and plans for care. With collections up and denials down, Dr. Williams can move on to easily identifying other business matters. And she and her staff can even get in a few hours for themselves. Imagine that. ModMed, your AI-powered practice, awaits.
So we got as many as millions. We heard millions of miles. We heard as little as 2,500. I remember hearing at some
I think
point.
we even had one that mentioned around 500.
500. Oh, yeah, you're right.
I don't mean to laugh. But realistically, when you think about the distance between, one little town or another, or your little trips to Target or to Publix to shop, you cover about 10 miles on that trip, and I guarantee you walk that pretty regularly within a week or so. So yeah. I mean, realistically, and again, knowing this from prior research, I think the average human walks about 100,000 miles in their lifetime, which is quite a bit. You're talking about quite a few trips around Earth in terms of that actual walking activity. So it's pretty impressive, and that's why our feet, again, are so important and have to, and they deserve to be protected. That's a lot of mileage.
Absolutely.
A lot of mileage.
Absolutely.
I know my tires get worn thin, and good shoes are important to protect them, and got to keep things moving.
Yeah, absolutely. It's 100,000 miles. That's a lot.
That is a lot.
People
That's a lot.
quantitate that. So what I get a stern talking to from my wife when I accidentally hit myself or stub my toe against a door or a side of a coffee table, and I let out this intense Neanderthal like scream. I scare my children, I scare the neighbors, all that. Is that good? If something happens where you get hurt and you let out the scream, is it good to let that out, or is it good to kind of hold all that in? What do you think?
Does it help if you actually scream when you hurt your toe?
No, because it's the immediate silence initially, because it's like, oh my goodness, I can't believe that just happened. And then you realize, wow, this is really painful.
Let it out.
Let it out.
That's words while we're at it.
Okay.
I think it's good to let it out.
Yeah.
I do. I kind of just let it out, and you're not burying anything. It's kind of like life, kind of like a breakup. You kind of just want to let everything out.
Let everything out.
Let it out. Yeah.
So
I don't know if you might sound like AC/DC when you're doing it, or
that's it, man. A little bit for those about to rock. So
we salute you.
And really on that topic, just one of the questions we asked was, what hurts more, stubbing your toe on a bedpost or stepping on a Lego? What do you guys say?
I'll say that. So my children are heavily into Legos right now, and they love building whatever it's supposed to be, then breaking it down and building new things. I personally think stepping on a Lego is the worst, especially if it's not on a carpet, different story, but a Lego on something, a hard floor, and you step on that. I have said some expletives more than I should have around my children.
Is that why your child cussed at me? Is that why? They learned it from you.
All the more reason not to go barefoot.
Yeah.
And I think it does depend on the Lego piece.
Yeah.
I mean, having been an avid Lego builder back in the day, I can recall that some pieces were more painful than others.
The square one there,
Yeah. Oh, yeah.
awful, dude.
Very small pointed piece. It'll get you. Yeah. And so needless to say, I don't go barefoot around your children.
There you go. Do not. Going back to the question before, is it good to let it out scream, or is it good?
So my background, I did study psychology before, and a nod to our neurology colleagues. We know actually that there's a pretty good link, within the neural network, if you will, that actually the act of screaming or saying an expletive or doing something along those lines is beneficial to actually, in some ways, inhibit a pain response. So anytime you have a pain stimulus, like stepping on a Lego or stubbing your toe, actually allowing some of that release does help to kind of confuse that network and believe it or not, actually make you perceive it as being less painful. So continue on with your curse words.
Continue on.
Please.
Let it out. So,
Yes.
Dr. Edgar Sy of Relief. If the shoe fits.
If the shoe fits, wear it.
If the shoe fits, wear it.
That was the first thing that came to my mind. Yeah.
You know what my response to that is?
Was
If
it-
the shoe fits, buy another just like it and wear both.
Wow. See,
I mean, being logical.
I
I
like
mean, really,
that. I
because
think
if you
that
have
makes
one
sense.
shoe, you wear it, but what are you going to do with the other foot?
well, that's true. That's true. Yeah, buy the other one. There you go. If the shoe fits, sparkle on. That's what I like.
Sparkle on?
Sparkle on.
I think you should demonstrate what you mean.
I don't have
Well,
those
so
shoes.
anybody who can see here, I got my Captain America socks on, and for some reason, I am a podiatrist, obviously, and I like wearing socks with shoes and support. I'm with people who are not wearing socks, so
There's another episode.
that's another episode. Await the future of our podcast for that one.
Wear the shoe if you know a good podiatrist that is part of the FDMA and that knows what he's doing and is affiliated with the association, can give you the best advice on what type of shoe that you need to wear.
Wow, that's a very good comprehensive answer. I was going for if it fits. Wear the shoe if the shoe fits, but that's actually that's better. I like that one.
If the shoe fits, you buy it.
You buy it. Okay.
Buy it.
I like that.
Before you wear it.
Yeah.
Before you wear it. All right, good.
Shoe fits.
Fits?
Fit the shoe. Fit the shoe.
Wear the shoe if you fit the shoe. Wear the shoe if the shoe blank
Fits.
fits. Straightforward. Pretty straightforward.
Let's leave it on one more note. Dr. Schweibish, put your best foot. What?
In the pile. No, forward.
Fine.
Yes. Forward. Put your best foot forward.
Dr. Edgar Sy,
Put your best foot forward.
put your best foot forward.
Yeah.
And that's what we're going to leave our audience with today. We're going to put our best foot forward. And podiatry and podiatric medicine, that's what we're here to help our audience with. We're here to help you put your best foot forward, get you back to the things you want to be doing, get you back to the activities that you love to do. We're here to educate, we're here to assist, and we're here to get you back to the lives you want to lead. I want to thank Dr. David Schweibish, Dr. Edgar Sy, and I want to thank Doug Loran and his team from Orlando Production, the OG from OP, Doug Loran. Thank you to his team as well.
The GOAT.
And the GOAT, GOAT. And then thank you guys so much for listening in. Stay tuned for more Real Talk with a Foot Doc, www.realtalkwithafootdoc.com. Below the knee, come see me, come see my colleagues. Thank you all for listening in today and stay tuned for more.